Hi, my name is Nicole Mansky. I'm a nurse practitioner student. Today I have Joe here. We're going to be going over the veins and arteries and the abdominal assessment. We already took his height and weight. Now I'd like to get his blood pressure. May I use your left arm?
Yeah.
Okay. I'll put this around here. Alright, I'll have you keep this arm on, just kind of relax it best you can. Okay, I got 130/72. Now I'm just going to feel this and get your heart rate as well with this timer here. Okay. Thank you. And that was about 78 beats per minute. Next, what I'm going to do is look over his entire skin. I'm just making sure that the skin is the same on both sides. It has the same texture, temperature, color. I'm looking down at the legs. I'm making sure that his nails are about the same on both sides. There's no clubbing. His cap refill's less than 3. It's a good color for his ethnicity. There's hair everywhere where it should be for a male of his age. There's no bald spots on the extremities. I don't see any edema on any of his extremities. I would check and make sure there's no pitting down here. I also see no edema on the hands or the arms. There's no ulcers or varicose veins present, and it looks like he has muscles that are appropriate. I don't see any atrophy. The next thing we're going to do is we're going to talk about all his pulses. First thing I'm going to assess is his carotid pulse. So I'm just going to feel here, Joe, on each side. And they're nice and strong. And while we're talking about the carotids, we'll listen to make sure there's no bruit with the bell of my stethoscope. The next pulse I'm going to do, I'm going to have you flip your arms over here. I'm feeling for the brachial pulses. And the radial, which are right here. I'm going to do popliteal on both legs. I'm going to go back to the femoral when we're doing the abdominal assessment. Okay. Posterior tibial. These are all 2+. And then the dorsalis pedis on the top of the foot. And all of those are 2+. Next thing I'm going to have you do, I'm going to have you lay down kind of up on those pillows. I want him to be at 30 degrees because I'm going to look at his jugular veins. I'm actually going to use a flashlight here to kind of peek at these veins. So I'm looking to see where I could see a pulsate, which the highest point is about right here. The next thing I would do is measure from the angle of Louis up into where I see it pulsating. So I get that angle, and where I see it pulsate is about right there. It's about, oh, wrong side. It's about 3 centimeters from where I see. I believe you add 5 to that, and that's what gets your centimeters of water for your jugular venous distension. Next thing I'm going to have you do, Joe, do you mind sitting up? I'm just going to take these pillows away and I'm going to kind of lay you flat for the most part. You might have to scoot down a hair. There you go. Thank you. Okay. Move these out of the way. Next thing I'm going to do is inspect your abdomen. Do you mind pulling your shirt up a little bit here? Okay, awesome. I'm looking for symmetry. I'm making sure there's no obvious bulges. I'm going to look down by the feet and I'm looking upwards just to make sure there's nothing that I'm missing just by looking. It's symmetrical on both sides. There's no pulsations. The umbilicus is inverted. And I don't see any venous patterns like varicose veins or anything like that. Okay. Next thing I'm going to have you do, I'm going to stand at the bottom of the bed here and I'm going to have you lift your head up like you're kind of doing a crunch. Okay. Yeah. Okay, perfect. And back down. So when he did that, I didn't see anywhere where the abdomen, where the muscles in the abdominal wall were like pulling. I didn't see any hernias or lumps that popped out when he did that. And when you take a deep breath and hold it, I'm going to look again. And out. And it looks like his abdomen rises symmetrically when he takes a deep breath. And when he held it, I didn't see any like masses or bulges popping out. Next thing I'm going to do is listen to the abdomen here. Actually, before I forget, uncross your legs, please. I'm going to feel your femoral pulse. Okay, now I'm going to listen to your abdomen. All right, I'm going to listen to all 4 quadrants, starting down here. I'm actually going to put a timer on while I listen to the quadrants because I want to see how many gurgles or clicks there are per minute. Okay, so in that 30 seconds, there was about 10 per 30 seconds, so 20 per minute, like gurgles or clicks or bowel sounds. So I would say his bowel sounds are normoactive. Next thing I'm going to do, I'm going to listen to the arteries in the abdomen and make sure there's no bruits that I could hear. First, I'm going to listen to the aorta. That is up and to the left of the umbilicus, so I'm just going to listen to a couple places here. Next, I'm going to listen to the renal arteries. They're on the left and right side, about 3 centimeters up from the umbilicus to the left and to the right laterally. And I don't hear any. After that, I'm going to listen to the iliac, which are 3 centimeters down from the umbilicus and to the right and to the left. And down into the groin, I'm going to listen to the femoral arteries. All right. I didn't hear any bruits there, nothing abnormal. Now with my fingers, I'm going to do percussion. So I'm going to tap on your abdomen, Joe, here. I'm going to do all the quadrants. And I hear tympani in all 4 quadrants. Now I'm going to listen to the liver borders. So I'm going to start at the top. What do I want to mark this with? I'll mark it with a pen. So I'm going to start up by the ribs. And what I want to hear for is I'm going to listen for resonance. And once it goes dull, I'm going to mark it. And then I'm going to start at the abdomen and I'm going to listen for tympani. And once it goes dull again, I'm going to mark it. So I'm going to start over here. I might have to start a little bit higher. mark right here. Okay. And then I'm going to start at the abdomen. And I'm going to mark right there. And I'm going to measure that in centimeters. All right, it's about 6 centimeters. I'll write that down. Okay, next I'm going to percuss for the spleen as well. It's about the 8th or 11th intercostal space, like over on the side of the arm, the mid-axillary line. So I'm going to feel way over here. Move your shirt, sorry. So I'm kind of waiting to hear that dullness, and it should just be a small area that you're looking for. Now I'm going to listen for the gastric air bubble. So I'm going to start here, and same thing. I'm listening for resonance, and then tympany. And right there I hear some tympany. So I'm imagining the gastric air bubble is right there. Once he sits up, I'll percuss the back of the kidneys to make sure there's no tenderness. But we're going to come back to that because I want to start doing the palpation. I'm going to slowly palpate your abdomen, Joe, in every quadrant. I'm actually going to go up and around. And not only am I going to do the 4 quadrants, I kind of want to go all 9 areas. And then feel around the umbilicus as well. And that's just light palpation. Any tenderness when I did that? No. I didn't feel any lumps or bumps or masses. The next thing that I'm going to do is deep percussion. So this is like 5 to 8 centimeters. And I'm using both my hands here. The first hand's just kind of relaxed, and the second hand's what's kind of doing the movement. I'm just looking to make sure he doesn't wince. Any pain?
No.
Okay. I didn't feel anything there either. The next thing what I want to feel for is his liver. So I'm going to put, there's a couple ways to do this. The one way I saw was 2 hands, and you kind of go 2 little passes. I don't feel anything there, but another way, you can put the left hand behind the abdomen and feel up, which I don't feel anything. Can you take a big deep breath? And out. And when he does that, I don't feel like the liver coming down or anything touching my fingers. The next thing I'm going to have you do, take another big deep breath. I'm feeling right here. Any tenderness when I do that?
No.
Okay. So that was checking his gallbladder, the Murphy sign, and he doesn't have any tenderness or pain when I push like up in the epigastric area. Next thing I'm going to do is palpate the kidneys. So I'm going to come over him and put my hand behind him. You're good. Okay. And I'm just going to reach deep in. And I don't feel anything there. They should feel smooth if you feel them. I don't feel anything there either. Last thing I'll do is feel for the spleen. So again, I'm going to reach my hand over, feel the bottom of his ribs, and I'm moving up towards his armpit area. Can you take a big deep breath in? All right, and relax. And I don't feel anything there as well, up by his spleen. I don't know if I said pancreas, but I meant spleen. That's what we're feeling for there. Next thing we're going to do, I'll have you sit up, Joe. Okay. I'm just going to feel what I'm going to have you do. I'll come behind you, actually. You're good. And I'm just going to, so I'm putting my hand between his 10th and 12th rib in the back and pointing up towards his axilla, and I'm going to hit my hand with my fist. Any pain there?
No.